Now, if we're talking about the drinking context, and we've been particularly focusing on-premise alcohol establishments, I would be remiss if we didn't talk about drunk driving and drunk driving policies, because that is one of the key short-term consequences of excessive alcohol use that we focus on in addiction science and in public health more generally. So, why is this important? Why is drunk driving important? Well, depending on the country, between 20 and 70% of all traffic accidents are alcohol related. About 30% in the United States. Over 1 million people die each year in alcohol related traffic accidents, but up to 50 million people are injured in alcohol related traffic accidents. And these road traffic injuries are the number one cause of death worldwide among teenagers and young adults. So this is a very large public health issue. So to try to minimize the impact of drunk driving, we can implement direct policies which target drunk driving specifically, and we can impact indirect policies which influence alcohol consumption, which hopefully have some downstream consequences in terms of influencing drunk driving prevalence. So just like we mentioned in an earlier module, we have direct policies and indirect policies that differ on their target as well as their area of effect. So there are numerous direct drunk driving policies that we can put in place. So let's talk about a few of them in terms of area of impact as well as effectiveness. So blood alcohol concentration limits, saying that it is illegal for you to drive if your blood alcohol concentration is above a certain point. And this includes zero tolerance policies for people under the legal minimum purchase age. So if you're underage, a zero tolerance policy essentially says that you can have no alcohol in your system if you're going to drive, and if you do, you will be punished. Now, there are a variety of different BAC limits in place in different countries. The United States typically uses a 0.08 level for their BAC. Other countries are down to 0.05. And some are a little higher, some are at 0.1. Just depends on the country as well as who can regulate it. Some countries will regulate it at a country level, others allow the states and provinces to regulate it, which occurs in the United States. But the key thing about BACs is that they are effective at reducing drunk driving. They are an effective anti-drunk driving policy, and they have a large population reach. Essentially, a BAC law impacts all drinkers, which in many countries can be up to half of the people in a population. So you not only have an effective policy, but one with a large population reach. Other effective policies are out there, but they have a much smaller population reach regarding drunk driving. So things like administrative license suspensions, ignition interlocks, mandatory treatment, and sobriety checkpoints work, but they don't reach as many people and actually really reach much smaller populations than BAC laws. So take ignition interlocks, for instance. So what an ignition interlock is a device that hooks up to your car that you have to breathe through. It's essentially a breathalyzer, and the car will only start if you blow less than the legal BAC limit. So if you're in an area where the BAC limit is 0.08, you have to blow into your car's breathalyzer at something less than that level in order for your car to start. If you are drunk or if you have a BAC level higher than that and you're legally drunk, the car won't start. Now, these work. They're very effective because the car simply won't move if one of these devices are in place. But they're really only used on repeat offenders. They're really only used on people who've already been caught drunk driving, and we're trying to do everything possible to make sure they don't drink and drive again. So they're effective, but for a very, very small number of people. It's the same with the administrative license suspension. You're really only affecting the people who drink and drink drive regularly. You're not impacting the larger population. In terms of direct policies, there are those that we know don't work. They're simply ineffective. These are things like designated driver programs. Now, people might like to talk about designated driver programs. They might want to talk about how effective they are. But the reality is that designated driver programs basically give people who aren't driving a way to drink more than they would otherwise, and the driver themselves still typically has a glass or two of alcohol. They still have one or two standard alcoholic beverages. So it's not eliminating the drink driving program. Now we also have warning labels. So there are warning labels in alcohol here in the United States. They're being developed in other countries, particularly in Australia, but they don't work. Initially, when they came out, drinkers noticed them, they read them, they're more aware of them, but they didn't actually change drunk driving behavior. And then there are other programs which are being pushed where we simply need more research. So we need more research on the role of safe ride programs, which is kind of an offshoot of a designated driver program. Although there is some research that the availability of programs like Uber or Lyft have not changed drunk driving rates in these certain communities. And then other things like DUI or DWI courts or 24/7 sobriety programs, which are very intensive, very focused on drunk driving and substance use. We simply don't know enough about them to say whether they can effectively reduce drunk driving prevalence. Now, just like with direct policies, there are a number of indirect policies that can impact drunk driving. So again, let's go through a few of these. So policies that are effective with large population reach are taxes and those dram shop liability laws. These impact all drinkers, they impact all establishments, and they are known to be effective. So if you want to reduce drunk driving, increase taxes. Essentially, taxes can save lives. That's the message that needs to get across. Programs that are minimally effective, they have some effectiveness, but really the research isn't there to back it up, implementing it population-wide, are things like brief interventions, government monopolies, mass media campaigns, and unfortunately, RBS training. So there is some research saying RBS training can slightly reduce the prevalence of drunk driving, but you're not going to see large wholesale changes. And it's the same for mass media campaigns. They're essentially ineffective. Unless they're combined with other enforcement activities, they don't really work. And brief interventions, while they work when you get people into a one-on-one setting, it's very difficult to get people into that one-on-one setting, and it's very difficult to get people to listen once they already have the signs of intoxication. Now, things that are ineffective in terms of these indirect policies are things like sales restrictions, so restricting the number of days alcohol can be sold or the time that alcohol can be sold. Essentially what happens when you change the time frame when alcohol can be sold. Let's say a city stops serving alcohol at 2 a.m. and you want them to stop serving alcohol at 1 a.m. You think that that's going to ban or prevent drunk driving. What it does is simply shift the hours where people are drink driving the most. Instead of them driving from 2 to 3, they're essentially driving from 1 a.m. to 2 a.m. So it doesn't actually reduce drunk driving prevalence, it just changes when they occur. In social norms programs, they do not work. Wholesale, they do not work at changing alcohol consumption, and they do not work at changing drunk driving prevalence. We do need more research on a variety of other indirect policies, which we think impact alcohol consumption, but we haven't extended them to drunk driving themselves. So things like marketing restrictions, these density restrictions, and social host laws, which focus not on the establishments, but on adults in the home serving alcohol to minors or people who are intoxicated. So more research is needed, more evaluation work is needed, using the skills that you have hopefully been learning throughout both this course and the certificate program to determine whether these indirect policies can positively influence drunk driving prevalence.